your thoughts on NHI, National Health Insurance, I think is what it's called.
Do you want to just
With
give
the
them a
government
quick brief about what NHI actually is?
No, I don't know what
as you
NHI
know?
is. You guys must teach us. Do you know what NHI is?
Yeah.
I think the man
I
who's
mean,
in family medicine
for the
can tell
ordinary
us.
person to
I
understand.
think I had to. So I think I'm gonna. So me, Pen, I like to. I can argue both sides of an argument. I can be devil's advocate, or I can be on the other side.
Sure.
And so I'm just gonna shoot back when he says our state doesn't care.
Okay.
Our state, our government, has some of the best policies in the world, some of the best acts.
On paper.
On
Yes,
paper.
yes,
Okay,
yes.
On paper, yeah. Let's
On
just
paper.
make
Sure.
it clear.
Yes, on paper.
Sure.
Okay. Has some of the best guidelines, some of the best, SOPs,
Yeah.
and the problem is implementation.
Mm.
So what the roadblocks and speed bumps are to implementation, I think are beyond me or beyond my conversation.
Yeah.
But I think that we know where we need to be as a country. Those who are running things at least know of where we need to be.
Yeah.
Again, why we're not there, or why they're not taking us there, or not able to, I don't know which one it is beyond my conversation. But there are people who care, and there are organizations who care, because there are places that implement, okay, these wonderful policies that I talk about. You look at our NDP, read the National Health Insurance. It's beautiful when I read it, as to what it can do for our people. So basically, I'll try to summarize what the National Health Insurance is. Basically universal health care. So no matter where you're from in the country, whether you're the poorest of poor or the richest of rich, we all have access to the same health care.
What do you mean by the same healthcare? The same
so
quality?
Basically, yes, supposed to be
Okay.
the same quality. So I'll give you an example. If I'm not sure which side of Joburg you stay, let me make a different example. If you stay let's say you stay in Parktown.
Yeah.
You stay in Parktown. There's Rosebank Private Hospital Netcare, which is down Oxford Road a few kilometers.
Sure.
Okay. But you don't have medical aid. You're a poor person. You stay in those flats on the closer side of Hillbrow, not in the nice Parktown, but more to Hillbrow. But you are still Parktown.
Yeah.
Okay. When you get sick and you've registered, you're going to register with Rosebank as your hospital.
Sure.
Okay. Or you register with that GP that charges 1,000 Rand a consult now.
Sure.
That is your doctor. And if that GP is full, you're going to find another GP where you're going to register that's close by to you. So even if you stay in Sandton and you move into Sandton and the GPs are all full there, they all registered with NHI, they all have patients from Sandton, the closest one for you is Alex Baba. You with your Louis Vuittons and your Gucci, your GP is in Alex.
Yeah.
Your clinic, if there's no GP, your clinic, Masikane Community Health Center, that's where you're going to.
That's the idea of NHI.
That's the idea of NHI, is that you don't need to drive, you don't need to get in an ambulance from Diepsloot and drive to Joburg Gen. You can get in that ambulance and you go to Four Ways Life Hospital.
Let me tell you what people think NHI is, people on the streets. NHI is the end of private hospitals, private healthcare. It's going to be public healthcare as it is now, but then it's going to be upgraded to like private healthcare level across the entire country.
Nope.
That's what people understand NHI to be. And you're saying it's not that. Other things will remain I don't know if you'll say remain the same, but people will have access to whether it's great service or whatever, as long as it's within the vicinity.
Within the vicinity, but that service, the aim is to have it standardized.
Can I just,
Sure.
interject there? One of the most important things that he mentioned is it's about universal health care, standardized health care.
The quality.
Yes. Now, here's my question.
Yeah.
How are you going to ensure that quality of healthcare? And what NHI does propose is that we would have to nationalize all of our healthcare. So that includes our hospitals, our clinics. So if you run a private clinic, if you've got a hospital, we're going to take charge of it,
Sure.
and we're going to pay you as we feel we're going to allocate budget, as we feel we need to allocate budget based on your needs. So if your hospital is in Alex, if your clinic is in Alex,
Yeah.
even though Sandton is down the road, because Alex has thousands, hundreds of thousands of people that live there, that's going to be allocated far more money. And if you live in Sandown, which is just across the bridge from Alex, then you're lucky enough you'll be able to go to Alex, and hopefully the money should arrive at your clinic, and your clinic should be upgraded.
Sure.
Yes.
And potentially, if you're living in Sandton, your hospital or your clinic that doesn't have as many people and isn't as busy, it's not going to be.
Is it going to get downgraded?
Potentially,
is that what's going to happen?
the resources now, but we're talking about nationalization where you have to reallocate resources based. So, for example, Joburg Gen, which is here, it has a specific budget based on what the services it provides.
Yeah.
Now, if that hospital is providing a certain set of services to only a tiny percentage of the population, naturally the government is going to say, we're not going to invest that much money in there. And inevitably, what's going to happen is private hospitals, the quality of their healthcare is going to drop. Currently, my issue is when we're talking about the quality of healthcare, South Africa, what always baffles me is when they talk about NHI. I feel like we've had NHI. We've had a good example of what NHI looks like currently in our country. It's just public healthcare. That's what NHI looks like on scale now, at a smaller scale. All we're going to do is upgrade that to a larger scale, where we take over private hospitals, private clinics, GP practices, whatever. Everything is going to be under the government's control. And it's going to look like what public healthcare looks like. And that is my easiest way to explain what NHI is to the layman. If you like what you see in a government hospital, that's what it's going to be.